Good morning, students. Yesterday we had been learned social problems, social disorganization, 17 sustainable development goals aim to solve the social problems. Then poverty, then physical and mental illness. Mainly we had focus on difference between social medicine and pharmacological medicine. We had understood that what are the importance of social medicine. Today, we are going to learn about, start with unemployment. What do you think about unemployment? It's a word. Employment means job. Unemployment is a just opposite, antonymous to employment. Detail going on. Meaning lack of job. International Labour Organization defined that without job past 4 weeks, look at this, people waiting for job. Define unemployment. Condition of labor market. Supply of labor is greater, number of available openings, which means opportunities. So supply is greater than available opportunities. So keywords should be remembered and keep it to your mind. Then kinds of unemployment. Subjective unemployment due to diseases, subjective factors or disabilities. Second, objective unemployment, 4 types. Seasonal, example agricultural job only in rainy seasons. Cyclical, for example 1 month having job, other month maybe loss of job, next month getting job, like this. Then structural unemployment due to social structural factors, maybe cause of illiteracy. Then normal unemployment. Next, causes of unemployment. First cause, economic dislocation, which means economic activities are maybe dislocated or abnormally, which means imbalancedly arranged. Then population, overpopulation. The government difficult to struggle to formulate the economic and employment programs. Then education, lack of education, illiteracy. Then social disorganization. As already we had been learned in last class, abnormal arrangement of social systems, lack of religious or economic or political institutions cause unemployment. Then effects of unemployment. Individual effect, unable to earn There is no job, there is no money. Unable to pay rent. If there is no money, we cannot pay rent to the anything. Then increases to malnutrition. So there is no money, there is no food. So people maybe suffer from poverty, which cause malnutrition. Then loss of self-esteem, students, which is very important one. Every individual need a job to self-confidence. If there is no job, just think about, is suffer from stress. Then leading to depression. Then effects on society or social, not using all resources. For example, in India, a lot of resources, but lack of the economic structure, difficult to use that resources. Then reduce the economy's efficiency. Lack of money, lack of opportunity to attain this job. Then socio-political. First is that civil unrest, which means conflict. Then lead to revolution. Students, as we know that in history of world, why the revolutions in USA, Russia, Germany, the fundamental factor is that lack of job. People, there is no job, there is no food, poverty, illiteracy. So try to change the government and implement or revolution to new government like democracy. So these are the socio-political. Then particularly totalitarianism. Totalitarianism means socialism just like. Next, measure to reduce unemployment. First measure, training program, job oriented training. Next, employment guarantee schemes. Then rural employment guarantee program. In India mainly rural employment is essential. Next, liberalization of labor market, which means a person having skill can search anywhere in India as well as anywhere in the world. That is called liberalization. We can search the job everywhere. Next, government employment program in India to eradicate unemployment. First program is that IRDP, Integrated Rural Development Program, to eradicate unemployment in rural. Second, DPAP, Drought Prone Area Program. So this program only launched in drought hit area. Then training for self-employment, for example, computer training, training for other handloom trainings for employee himself or herself. Then Jawahar Rostra Yojana, this is one of the program. Yojana means employment program, which is then employment in foreign countries. Now OMC means Overseas Manpower Corporations. The government opportunity to register your skills, the education in that organizations. They search, other countries can search to India, any person having particular skills and call to, including nursing job. Next is that self-employment to educate unemployment youth. Then small and cottage industries. Students, which is very important one. Small scale industries, for example, 5 or 10 members together form a industry. Then development of organized sector, organize to eradicate unemployment. Then employment exchange, as we know that government, employment guarantee schemes, then employment assurance schemes, Prime Minister's integrated urban poverty eradication program, then unemployment and health. Students, is unemployment affect health? Yes, already as we had been learned that first affect mental health, stress, depression, then social well-being, lack of job. If a person no job, difficult to living spontaneously, and stress, they may experiencing social disabilities. Then physical health. So these are the mental and social disabilities directly impact on physique and cause various physical illness. Then role of nurse to reduce unemployment. Nurses doing fundamental role, as we had been learned that in this improve health. If good health, then only we can search good job, we can develop our skills. So nurses doing fundamental role to eradicate subjective unemployment, which is directly impact on objectives. Then prevent diseases, promote health, then educate the community, how to get good job, what are the job opportunities are available in the particular community, what are the government schemes in community level, and what are the self-employment program in rural as well as urban, educated by the nurse, then implement government programs, including various unemployment or eradication programs. Next section, illiteracy. What do you think about illiteracy? We know that literacy means able to learn. Illiteracy means unable to study. A person not able to read or write. Detail going on. Meaning unable to read and write. Lack of education. Look at this. Father of our nation said that mass illiteracy is India's sin and shame and must be liquidated. Then define literacy. UNESCO defined that ability to identify, understand, interpret, create, communicate, compute, printed, written materials. So key word is that ability. Involving continuum of learning, enable achievements, goal, development, knowledge, development of potentials, and participate fully in the community. So which is a fact. If we have a literacy, we can fully participate with community and develop self as well as society. Then we need to know about what is meant by illiteracy. Can you define? So only one word is should be changed. Look at this. Inability. In literacy, ability. In illiteracy, inability to identify, understand, interpret, create, communicate, compute, printed, written materials. The literacy in India. Key for socio-economic progress. Next to the health. First health, second literacy. India literacy rate grows 74.04% in 2011, but in 1945 only 12% only literate. Just imagine, within 50 years, 50 to 60 years, the India achievement. Highest literacy rate, now increasing literacy. Then causes of illiteracy in India. Economic condition. First cause is the poverty. There is no money, how to learn, how to go to school. Then ineffective implementation. Lot of program available, unable to implement. For example, till nowadays in tribal area, the people living under the poverty line, there is no schools, living in hills. There is a government lot of program for ST people. Then lack of entrepreneurship. Entrepreneurship means a individual person not willing to invest on education. 4. Work rather to study. 5. Emigration of educated individuals. As we know that if a person well educated go abroad and settled there, they don't like to came back. So Indian population always living under the illiteracy as well as related social issues. Then government schemes to reduce illiteracy. National Literacy Mission, Total Literacy Campaign, Midday Meal Scheme to prevent dropout, then Integrated Child Development Program, then scholarship. Various kinds of scholarship. Then role of non-governmental organizations, the number of numerous NGOs working for eradicate illiteracy. The key important is that Rotary Club, Lions Club and Agram Foundation. Agram Foundation mainly in Tamil Nadu, and Rotary Club and Lions Clubs are the international NGOs. They work in India to eradicate illiteracy. Then illiteracy and health. It has been affect mental health, social well-being and physical health, as we had been learned earlier. Then role of nurses to reduce illiteracy. Nurses doing fundamental role, promote mental health. Good mental health only increasing good environment for learning. Then community education. Educate to every family members to superiority of the education. And primary health care. In primary health care nurses is that focus on educate to the every child in the families. And try to collect data. What are the children are not able to learn due to economic factors or other factors. Try to inform to other government authorities to improve education in every families. Then school health program, as we know. Then implement government program, various the implement program, this government literacy programs are implemented by the nursing professionals directly as well as indirectly involved. Next major issue in our society is that crime, different types of crime. Define crime: anti-social behavior, violated public sentiment. What do you think about anti-social? Against society. Some act may be violate public sentiments. Look at this: murder, theft. Then elements of crime. An act, first element. Act must be voluntary, which means a behavior voluntarily do. Intentional, then violation of criminal law, which is very important key element. A behavior violate criminal law, which means violate human rights, disturb others' rights. Then without justifications, they don't think about what is just and injustice like this. Then crime in India: black marketing, adulteration and corruption, smuggling. Then murder, homicide, theft. Then crime against women, domestic violence, female infanticide, illegal drug trade, armed trafficking, wildlife trafficking. Nowadays, cyber crime. Cyber crime means is a misuse of the modern technology, mainly mobile phone, computer, internet, like this. Then police misconduct. So these all the criminal or crimes are exist in our society. Everyday newspapers we could see in that. Look at this, one of the graph. In rape in red in color, kidnap in green in color, murder in blue in color. So kidnapping always increasing in this. The graph shows that kidnapping always increasing, as well as rape also. In this year till 2003, nowadays declining. Then murder gradually declining. Yes, so this is one of the evidence. Then causes of crime. One, biological causes. Biological means hereditary, some genetic factors, criminal behavior from parent to child. Then psychological causes, mainly low intelligence, negative personalities. 3, economic causes. So this is one of the important causes in India. There is no food, no cloth. So a person try to theft for fulfill their basic needs. Then sociological causes, social disorganization, social disabilities, as well as civil disabilities. Then crime prevention. The World Health Organization, the Assembly resolution 5624 for government to implement recommendations. So students, crime is a major issue in our society. So crime directly impact on health status of people. So World Health Organization have been taken considerable measures, recommendation to each governments following. First recommendation, National Action Plan for Violence and Prevention. Second, collecting data regarding violence. So what are the data, what are the consequences? That data is very essential for analyze to prevent that type of crime. Then define priorities to prevent the violence. Then promote primary prevention, which is very important one. So before the crime, try to stop, protect the people from that criminal consequences. Then strengthen response. For example, anywhere is crime done, should be quick response is essential. 6. Integrated violence prevention. Which means this violence is directly linked with other sectors, including social, educational policies, promote gender and social equalities. For example, violence against women due to lack of education. Next, increase collaboration, exchange of information on violence prevention. Collaborate with other government, other countries, or other departments within the country. Next, international treaties. We know that terrorism is a major criminal practices in the globe. So that there is need international treaties. Some criminals maybe done crime in the nations and travel to other countries. That time need two countries agreements to exchange of the criminals. Next, international agreed response. For example, global drugs, global arms trading. The legislative measures to prevent crime. Indian Penal Code 1860. Students, this is one of the penal code means punishment. This is a act has been classified. What are the punishment for each crime? Then Dowry Prohibition Act 1961 prevent violence against women. Then Criminal Procedure Code 1973. So these are some legislation try to prevent crime from the society. Then crime and health. Crime always affect physical health, mental health and social well-being, criminal behaviors. This should be prevent crime. The next is that role of nurse to reduce crime. Nurse is doing fundamental role. One of the specialty in nursing is that forensic nursing. Is called is that legal aspect of nursing. Is in doctors have been study about forensic medicine. Okay, so study about investigation of the support to investigation of crime and help the catch the criminals and educate the community. Mainly support. The community education is very important. The community health nurses visit every families and every communities, identify the criminal behaviors, and as well as criminal behavior are directly linked with mental health problems. Okay, mental health issues. For example, personality disorder directly linked with the criminality, as well as substance abuse. Substance abuse, for example, rape, violence against women. Is main cause is that nowadays studies is that substance abuse, who use alcohol or other substances, which is influence the crime. So nurses doing fundamental role to educate the community to prevent alcoholism, drug addiction, and try to develop good personalities and prevent personality disorders, etc. Next section, juvenile delinquency. What do you think about juvenile? Juvenile means child. Delinquency means crime. So this section we are going to detail about juvenile delinquency, child crime. The age is that, according to Juvenile Justice Act 1986, 16 years for boys, 18 years for girls. So below 16 year, 18 years girls did any crime which is not concerning the actual crime, adult crime. So this boys and girls, there is no punishment, only treatment. The criminal behavior is one of the mental illness due to various mental factors. So the various treatment facilities are available by means of various institutions. Defined juvenile delinquency: violation of criminal code, certain pattern of disapproved behavior by children. Keyword is that children, young adolescents, age already we had been learned. Types of juvenile delinquency: individual, group. Individual means a child, group means 2 or 3 children. Organized means plan to did crime. Then situational means, according to, for example, a child feel this hungry and thirsty a bread, which is situational delinquency. Then causes of juvenile delinquency. Welcome back, students. Now we are going to start with types of juvenile delinquents. Already we had been learned this: individual, group, organized, situation. Causes: broken family, which means a family disorganized, children may be separated from parents. Second, neighborhood. So this issue mainly in urban setting. The children are together and try to do some crime, organized as well as group. The most important cause is that cinema, pornographic literature. A child seen that, a picture, the murder, theft, and other crime, and try to do that. Then literature. Then method of treating juvenile delinquency. First method, psychotherapy. This therapy mainly for personality problems. The main cause is that due to, this is one of the important causes, psychological factors. So psychotherapy is very important. Then reality therapy. Now some children did crime due to unable to fulfill their basic needs. So that time, educate about reality and try to remove that type of criminal behavior. 3, behavioral therapy. By means of actions, to educate and create awareness regarding good behaviors. Then active therapy. So this therapy is very important, age group 6 to 8 years. So criminal behavior having these 2 years, the active therapy need to implement. Then environmental therapy, produce favorable environment. So maximum cause of child crime is that environmental fact. For example, neighbors, 2 or 3 children together and share some knowledge and try to do crime knowingly or unknowingly. So if good and pleasant environment, positive environment surround the children can create good behavior. Then other methods, social case study. Then individual counseling, etc. Then occasional counseling, which is concerning skill development. For example, different types of skill, arts or painting and dancing, that type of skills can help to reduce criminal behavior. Then correlation institutions, various institutions only working for this type of issues in our society. First institution, remand homes. It means just like jail for adult is a remand for children's. There is no punishment, only treatment, and education is there and skill development, try to remove the criminal behavior. Then juvenile court, the court only for the child who did crime. Then observation homes, certified or reformatory schools, doorway school, probation hostel and homes. Then juvenile justice board is one of the important board, is accused of crime JJB, which means juvenile justice board. Before this board, the Juvenile Justice Act, Care and Protection of Children's Act 2000. This act was amended in 2006. Under this act or legislation, provision of criminal code, procedure, children are not to be taken into regular criminal court. Okay? JJB. 2000 Act 2000, criminal code, mainly procedures. For example, any children did crime, the children are not submitted in the actual regular court, but only in the criminal court and the children's court. Next, juvenile delinquency and health. Death and disability linked to antisocial behavior in youth. Juvenile delinquency linked to undetected health problems, mainly sight, hearing, speech. Then many juveniles offenders have multiple mental health problems. Then role of nurse in juvenile delinquency. The nurse is doing wonderful role. For probation hostels, mainly the administrated treatment methods of administered by the nurses. Then psychotherapy, behavioral therapy administered by nurses. Then counseling given by nurses. For example, this is one of the requirement in community health nursing. They link with sociology. So you need to visit a institution, okay, the child welfare institutions in remand home as well as that time you can more knowledge experience from that type of institutions. Then child health nursing. The child health nurses from the birth and try to identify these personality disorders and remove the criminal behaviors and promote pleasant and wealthier and healthier behaviors. Next section, alcoholism. Alcoholism. What do you think about alcohol? A substance. Ism means over use of alcohol, is terminology. Then define alcoholism: drinking frequently, continuously, with any of his important life adjustment and interpersonal relationship. Keywords, remember: do not be influenced by peer pressure. Then factors of alcoholism: excessive intake, increasing worry. A person intake alcohol may be avoiding worry, but it's impossible. First, small alcohol for avoiding worry, then that amount of alcohol is not enough for removing the worry. That's intake, excessive intake, and which is ended with alcoholism. The loss of control, mental control, physical control, then disturbance in functioning. Everyday life always disturbed. In alcohol in India, 10 to 15% take alcohol. In USA, 74% males, 26% females. In developed countries, there is more amount of alcohol use. Some people in the alcoholism. Look at this picture. Causes of alcoholism: biological causes. For example, to remove the pain, and genetic factors, parent to child. Then psychological causes. Psychological causes including the personality issues, intelligence. Then sociological causes, the familial factors, friends, mainly peer group, friends together and drink alcohol. Somebody went use more alcohol, become alcoholism. And spiritual. Then types of drinker: social drinker, friends together and drink in the time of celebrations. Then stress drinker, for remove the stress, drink alcohol. 3, binge drinker. Binge means use excessive amount of alcohol to avoid issues. Then self-medication. Self-medication means for particular therapeutic purpose. For example, experiencing cold, that time use alcohol and pepper like this. Then high-risk drinker. A drinker difficult to eliminate or difficult to cure this type of drinkers. Next, process of alcoholism. Pre-alcoholic symptomatic phase, which means this is the first phase. They intake alcohol at the time of celebrations or friendship like this. Then prodromal phase. After that, the person feel guilty if not intake alcohol. Then crucial phase, loss of self-respect. In this phase, they do not respect self, only respect the alcohol. Then chronic phase, indefinable fear and impaired thinking. So this stage, the physiological factors affected, brain damages, this mainly the neuroendocrinal imbalances, etc. Simply remaining pre-alcoholic, prodigal, crucial, chronic. Then problems. First problem is that personal misery, unable to think, unable to learn. They feel differently. Family discord. If a person intake alcohol, the family mainly we can expect problem between husband and wife, and children may be disorganized. Then loss of wages, a person unable to do job, there is no money. Failure of health, as we had been learned. Then economic loss, loss of wealth. Then health risk, anemia, cancer, cardiovascular diseases, cirrhosis of liver, dementia, depression, seizures, gout, and high blood pressure, infectious disease, nerve damage, pancreatitis. Students, you will experience, I would believe that, the maximum of patients come into the hospital with non-communicable diseases. The maximum percentage is that a person drinking alcohol. Look at this, alcohol and health, 3.3 million deaths every year. Then prevention, CDC methods. CDC means Center for Disease Prevention said that education is first method. Then regulation of alcohol outlet density, increase alcohol taxes, drum shop liability, maintain limits on days of the sales, maintaining limits on hours of this sale, which means days means 1 week only 2 or 3 days selling the alcohol. Hours means particular hours, for example morning or evening, like this. Then electronic screening or brief intervention. Then enhanced enforcement of laws prohibiting sales to minors. So mainly teenagers or children not allowed to this consuming the alcohol. Then treatment method, detoxification in hospital. Students, a person intake over maximum amount of alcohol which cause damage, all physical, mainly endocrinal factors, neuroendocrinal imbalance, the blood mainly toxic. So that is called detoxification in hospitals. Various the medical procedures are available. Then next is that role of family. So this is a family medicine. The main cause of alcoholism is a family. Any stress in family, the person intake more alcohol. Next, Alcoholic Anonymous, share experience with other alcoholic persons. Then treatment centers, changing value through education. Then social medicine. So social medicine is a primary medicine to prevent the alcoholism as well as treatment. Alcoholism is a chronic mental illness. There is no medicines. A person try to modify their social life, lifestyle modifications, change materials, and promote individualization and socialization with good people, not alcoholic ringards, socialize with good people and cut off bad friendship. Like this is the social medicine. Next, alcoholism and health. As we get beyond physical health, cardiovascular, non-communicable diseases. Then mental health, brain damage. Then social health. In a society do not accept a person become alcohol. So a person experiencing social disabilities. Then role of nursing to reduce alcoholism. Care give to, mental health nursing. This is one of these important procedure under substance abuse. Okay, mental health nursing. That time you will be care give to alcoholic patients. Then treatment provide to prevention, counseling to alcohol. If a person come in the hospital with fully drinker, after the advice of nurses and education, counseling of nurses, a person discharged with that away from that bad habit. Next section, drug abuse and drug addictions. Drugs, what do you think about drug? A chemical substance. Abuse means misuse that. Okay, addiction means overuse. A person cannot living without drugs. That condition is called addiction. Then drugs. Chemical substance with distinct physical and psychological effects. Next, drug addiction. Definition: state body requires continued administration drugs in order to functions, as we had been learned. Without drugs a person difficult to living. That condition is called drug addiction. Normally, look at this: drugs, drug abuse. Abuse means misuse of drugs or irrational use of drugs. Then define drug abuse. It's also known as substance abuse. Consumers or consumes the substance which are harmful to themselves as well as others. For example, in family, a person continuously using drugs for living. So not only affect this individual as well as whole families, as well as societies. Then drug addiction. Definition: addiction is a chronic, often relapsing brain disease that cause compulsive drugs seeking. And despite harmful consequences to the drug addiction, those around them, drug addiction is a brain disease because the abuse of drugs leads to change in the structure and functions of brain. Look at this, one of the MRI, can you see that? Yes. Normal brain. So this is 1 month use drugs. Changes. This is 14 months. What are the changes? Full brain damages and difficult to function normally and impaired thinking, etc. Next, characteristics. Overpower desire. A person getting more power and use this substance. Then tendency to increase dose, which means in first day or first week only 1 pills may take. Second week that pills not enough, they take more pills, so increasing the dose. Then psychological and physical dependent. Psychologically a person addict that, and physically as well as. Then affect society. not only individual affect whole society. Students, the fact is that various crime in India, including rape, murder, and the main cause is that a person using the substance or drugs. These are real findings. The category of drugs: alcohol, sedatives, stimulants, narcotics, and hallucinogens, nicotine. So one of the poster causes, psychological causes to remove burden, social causes, social experiences, for example improving memory, then physiological causes, getting sleep, then miscellaneous causes, religious insight and improving study, etc. Then effects: addiction is a first effect, a person addict on it. Then medical, neurotoxicity, AIDS, cancer. AIDS is, we know that, for example, a group of people use syringes and administer syringe, only one syringe, share their syringe. So one person having this AIDS, everyone sharing. Then economic, productivity loss, loss of employment. Then social effects: homelessness, crime, violence, mainly violence against women in families. A person take drugs, brain damages, unable to think, and which leads to the various violence. Look at this effects in this poster: addiction, brain, physiological addiction; medical, AIDS, cancer, and other diseases. Social, look at this: a person use drugs and disturb the street and people in the society. And economic, healthcare, productivity, and accidents, etc. Then control measures, how to control this: first, education, then change in attitude of doctors. Students, maximum of drugs are misused by the medical professionals. Doctors only write to prescribe medicines, so need to change the attitudes. Only rational use of medicine is essential, rational prescription. Then detoxification program, then punishment, then legislations, new laws should be enacted. Then legislative measures: Narcotic Drug and Psychotic Substance Act, then Prevention of Illicit Trafficking, Narcotic Drugs and Psychiatric Substance Act. So these all this legislation. Next is that one of the bureau, Narcotic Control Bureau, control the use of production of drugs. Then Drug and Cosmetic Act 1940. So this is a legislation define how to store the narcotic drugs. This is a narcotic drug legislations. In hospitals, they have been using drugs, narcotics. That drugs are separately stored. Students, when you go to hospitals, just examine it, okay? Every drugs are one place and narcotic drugs are separately stored and separately registered. So to prevent misuse of this type of drugs, which is this emphasized by and in these legislations, as well as trafficking. Trafficking means how to transfer a narcotic drugs. Without permission, cannot allow to transfer these types of drugs, and so these are the legislation support to prevent misuse of drugs. Good this. Then drug addiction and health. drug has been affect physical health, mental health, and social disability. Then role of nurse to control drug abuse and addiction, care, cure, prevention, rehabilitation. You know, this in mental health nursing, this is separate one of the procedure. Okay, next year we will learn detail about it. Substance abuse. Next is that students, this is very important one. We are nurses are responsible to administer the drugs in the hospitals. So we are responsible to prevent misuses by means of rights of nurses on medical or medicine administrations. What are the rights? Right patient, right medication, right dose, right route, right time, right documentation, right reason, and right response. So these are the responsibility of nurses and rights to prevent misuse or irrational use of drugs. Then problems of house. Okay, thank you
Thank you,
everyone.
sir.
Have a wonderful day.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you.